views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗹. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗹. I'm your host, Nicole Jacinto. And on today's show, we're going to discuss prostate cancer. Hello, we have Dr. Jaime Songco with us again today. Thank you for coming back, Doctor. I remember I did say that please come back anytime to talk about anything, and I'm so happy that you came back to the show. Thank you for sharing your knowledge and making the effort to be with us today. So,
Thank you for inviting.
yes, by the way, to all the fathers, good fathers. Belated Happy Father's Day. Dad, belated Happy Father's Day. I spoke to you already. Okay. If you're a father, Dr. Songco, Happy Father's Day to you. All right. So today we're going to discuss prostate cancer. And I guess since it's after Father's Day, we should look after, the male population because, okay, doctor, can we start by talking about what the prostate gland, or is it a gland, is it an organ? What is its function? And of course, if you have a prostate, you must be a male.
Exactly. Well, thank you for that. The prostate is actually an organ or a gland that is situated below the bladder before it goes down to the male tube or the penis or the urethra. Okay, it's actually like a chestnut size organ, or
like a walnut. Not
maybe more or less about 20 cc or grams. So that's about walnut, not the huge ones. Okay. Now the main purpose of this prostate gland is to secrete liquid. Okay. The prostatic liquid, or we call seminal fluid, is the one that propels semen out or helps it to be propelled out into the urethra. So that's its main purpose. It also has antibacterial properties. So it's like a tonsil below.
Okay.
So if at all, that is the main purpose. Now, if you're a male, you're born with it. Okay. And eventually, because of aging, it gets into size, or a certain amount of size or degree of enlargement that produces all these sort of symptoms that happens among men.
Okay. Dr. Songco, thank you for telling us what the main purpose of the prostate gland is. So if I can just maybe do a short recap. And of course, I'm being educated by you, so please correct me if I'm wrong. Jump in anytime. So the main purpose is actually to secrete semen. Basically, no?
Seminal fluid.
Seminal fluid, okay. Seminal fluid that will contain semen, and of course, the sperm is there. So for reproductive purposes or whatever, the prostate is essential to that. And I guess it's essential also for men to get an erection in that sense, no? For purposes of having sex, of engaging in sexual activity. It's normal, it's a natural thing. And so that's the main function. I'm so curious now, because you said it also acts like a tonsil. So basically, like, everyone has tonsils or are born with tonsils, I guess, unless you're like, very different.
Yes.
Our tonsils are located in our throat, and you said it has that the prostate acts like a tonsil in a way that it has antibacterial properties. So if there's anything there, because like our tonsils will catch bacteria, that's why we get tonsillitis, right, doctor? Like, oh, it will catch it before it goes down to our throat and all of that. That's why tonsillitis is often like everybody everybody has had it at some point.
Correct.
And then you have the removal of the tonsils, but we're not here to discuss the removal of the tonsils, just relating it to the prostate gland. That's an
Yes.
amazing thing. I mean, I don't think a lot of people realize that. And like I certainly didn't. So thank you for teaching me that today, doctor.
Yes.
Okay, so when it comes to the prostate gland and prostate cancer, I mean, why, like, what happens exactly when someone gets prostate cancer? And probably also what causes it. But I guess those are two interrelated questions. So,
Yes. As I said, the thing that makes the prostate become symptomatic in men is aging.
aging.
Okay, aging. Anything or anybody goes beyond the age of 50
Mhm.
will have some hormonal changes that will happen in them. And the irony of it, despite the testosterone going down or lower than normal, the prostate gets big.
Okay.
It enlarges, and to the point that it may encroach on the tube of the urethra where urine passes.
Mhm.
And this is where the symptoms first happen. Okay, and people will have frequency of urination, slowing of the caliber and flow, waking up often at night, incomplete draining or emptying of urine. So these are the signs and symptoms of benign prostate enlargement.
Of
Okay,
benign prostate enlargement.
which
Yeah.
that is basically maybe 7 out of 10 Filipinos will have it, or men, not only Filipinos but anywhere. 7 out of 10 will have symptoms and will need management or treatment. Now,
Okay.
on top of that, aging too can propel the prostate to develop into a tumor, like
Okay.
a malignant one.
All right.
Okay, at the early stage of the tumor or prostate cancer, you may not feel anything.
Mhm.
Okay, when you start feeling something, that's where we call it late. And this is the reason why screening is more important. You know,
Yes.
the PSA, a regular visit to your doctor, a PSA check, and other tests similar to that can be done to more or less screen you for the probability and finding out whether you have that illness.
Mhm. So, doctor, okay, so basically, I'd like to ask you a little bit more about something you said. You said, ironically, or the irony is that testosterone goes down in men age 50 and up. But any man or any male who's age 50 and up has a higher risk of getting like either benign prostate enlargement or prostate cancer. And you mentioned some of the symptoms, which are like difficulty urinating, or parang you can't, you feel that you still have urine, like it can't be drained properly. And of course,
Yes.
folks must remember that the prostate also, I mean, the urethra, the man's urethra is where they pass urine and also pass semen. So it's the same thing. And as the doctor was
Correct.
saying, it can be enlarged. Your prostate can become enlarged and push on the urethra, and you will feel these symptoms. And then like you have to urinate more frequently, and there's different symptoms. But I mean, there's two ways to go about it, as you said, doctor. One is that it might be benign. So if you have yourself checked and do screening, then of course you will not panic. But then if you do have prostate cancer, you may be asymptomatic at first, like you don't feel anything. What are the symptoms that, and then once you feel the symptoms, you might already actually have the cancer, but you just didn't catch it at an early stage.
True.
May I ask, doctor, like for men with benign enlarged prostates, do you treat them as well? Do you do anything?
Yes.
Okay. All right.
But just to make it clear,
Yes.
Nicole, no, they can happen independently or on top of each other.
Okay,
Benign prostate enlargement and prostate cancer, though they're totally different clinical entities can happen together or independently. When you talk about BPH or benign prostate enlargement, you are talking of just for easy for people to remember easily. The initial symptoms will be fun. The word fun, okay? Frequency, urgency, and nocturia.
Nocturia at night.
Frequency of urination, urgency, meaning you want to go often, even if you're not yet really that full, but you have the urge.
Yes.
And nocturia is waking up more than twice a night. When you see your dad or your lolo waking up very often at night and starts to wet the bowl everywhere, so you know already that his prostate is coming into play. The later symptoms will be wise. Weakness of urinary stream, intermittency, stranguria or pain, and incomplete emptying. So these are the later symptoms of benign prostate enlargement.
The later
prostate, this is the more advanced symptoms, no? Meaning from irritative symptoms, it becomes obstructive. Okay, so the initial symptoms will be irritating. He wants to go to the bathroom often, irritated siya. Later on, it will become obstructed or a little bit more obstructed where he presents as, weakness of stream and flow, intermittency, meaning paputol-putol lang yung wiwi niya. There may or may not be pain, and then there's always a feeling of incomplete emptying. Those are the later symptoms. Now, for prostate cancer, as I mentioned earlier, usually early stages wala. It's like BPH then. Okay. That's the reason why we advocate men at 50 and above seek consultation right away and clearance. And whether it's annually or more often than you like it, fine. But the later symptoms usually are through obstructive signs are always present, and then pain, especially bone pain. Okay, pain to the bones, especially the long bones and the lower back. So if you are experiencing pain in the bones and lower back, then that would be a possibility of or more probability of prostate cancer. Hello?
Hello?
Yeah, did you get me?
Sorry, I got...
Yeah, you hung for a while.
Okay. Yeah, let me just get back to you, doctor, because I cannot see you, but I can still hear you. Again. Yeah, okay, there we go. Sorry. These things tend to happen because of telcos. Okay, let's not get into... Let's not get into politics. At least we're doing our best to give information out there. Well, it's not really politics. It's just like, hello, good governance and service, But anyway, okay. So like the Wi-Fi and internet, whatever connections and the telcos, paputol-putol when it's, when someone is urinating, when a man is urinating or the older man is urinating. And then and then there's pain, and then parang they can't totally drain it, and they have the urge to pee all the time. And doctor, I've heard also of men who like suddenly get blood, or they find blood in their urine. Is that related to prostate cancer? Is that totally different?
It may or may not be related all the time. It can also happen in patients with just benign prostate enlargement, where the obstruction is a little bit more severe, and you develop cystitis or infection of the urinary bladder and produces bleeding.
Okay. And it could come from different things, basically
Yes.
I'm sorry, I'm leaning in, guys. It's just my glasses are, I think I need to go see an eye doctor. But okay, Dr. Sonko, thank you for explaining that to us and letting us know that there is a difference between benign prostate enlargement, yet it can come also with actual prostate cancer. It can come together, be different. So the thing to do is to really go to your urologist, your doctor, go to Dr. Sonko. I won't be paying you for that, but I hope the other people watching here will, because it's the thing that you're stressing is early detection. Can I ask you mentioned PSA doctor earlier? talk about some diagnostic tools. PSA is a blood test, I understand, for
Yes,
tumor.
it's a blood test. It's a blood test. It tells us more or less we have a tumor marker that guides us, especially when it's off mark, and it tells whether this patient has the probability or not of having prostate cancer. Although it's, as you know, PSA is not really that 100% accurate, but we can use it as a barometer in as far as trying to gauge whether this patient has it or not, and correlate it with other imaging modalities that we can offer.
Okay, so when now, doctor, you're talking, or the conversation is going toward diagnosing it. So PSA, or a blood test, is one of the ways that a doctor can diagnose whether or not you have prostate cancer. But it's a tumor marker that isn't always, as you said, 100% accurate. Like there can be false positives. Is that correct?
Yes, that's why we use the PSA not only once. We check for the PSA velocity, meaning the amount of increase it does every so often, and we correlate it with other
Symptoms.
imaging, like especially the MRI.
Okay, doctor. So
The MRI.
okay, so there is the PSA, there's the MRI, and do you have other diagnostic tools or like equipment that you use to actually to say like, okay, we've diagnosed it, you do have prostate cancer?
Okay, let's look at it like years ago. The thing that makes men probably fear urologists will be the finger.
Yes.
Okay, because before the tool that they have is the digital rectal examination.
Yes.
Which is more still used now, but it's not as sensitive. I'm probably only 25-30% accurate because I cannot feel the other side. I can only feel the posterior side, which although may be the site of most cancers, but not all the time. So the PSA as a tumor marker will give me more information in as far as the value itself, plus correlating it to the possible MRI if the patient needs it.
Okay.
And so this upgrades our diagnostic acumen by 75%. So, and lastly, if I have a very strong index of suspicion, elevated PSA, elderly patient, positive MRI, I'll probably offer biopsy.
Biopsy, yes. Okay, so doctor, just going through the tools for diagnosing, when we say digital, it means using the finger.
Yes.
I mean, finger, sorry, not the
Yes.
finger, because it's a digit. Okay, because nowadays with digital, the word is thrown around. Someone might think, oh, it's a thermometer or something like that, right? Okay,
Yes.
younger people. And okay, so before it was you check the prostate, the main tool, like way back, was you have to check the prostate with your finger. But as you said, you can only feel, is it the bottom part or the posterior where most
Yes.
probably manifest, but then you can't see the other part because some tumor or growth or abnormality in another part of the prostate. So you use basically three tools. Okay, the digital or the finger would be a clinical thing, and then the PSA, the blood work, and then also you use an MRI to get imaging of that exact the prostate itself and where it might be. So MRI is best for this, doctor? That's the best tool?
The multi-parametric one. We use the multi-parametric MRI.
Okay, multi-parametric. Wow. Okay, so multi-parametric MRI. Okay, thank you for telling us that, doctor. And as you said, with all of that, it helps you diagnose properly. Like it gives you like a 75% higher accuracy of being able to diagnose. Now, how would a patient? Okay, how common is prostate cancer? You did mention earlier that 7 out of 10 men, not just Filipinos, might get it.
We'll have the BPH or the benign prostate enlargement.
Okay. And
for prostate cancer, I think in our country, 1 out of 8 men will have prostate cancer in the Philippines.
Okay.
That's according to Globocan data. And in as far as incidence is concerned, among men is the number 3 cancer that can happen in men, outside of lung and colorectal. Now, the prostate is number 3. Okay. But you have to remember, not only here but in other countries, is the second leading cause of death in men above 78 and 78 and above.
Okay.
Second leading cause. Okay, so looking at it, it's pretty common. So if you have an elderly male with back pain, thinking that it's probably bone, primarily bone, do a PSA first, because it might be bone lesions coming from the prostate. And I've got patients or a lot of referrals like from orthopedic surgeons thinking that the primary problem is the spinal cord, when in fact pala, it is metastasis from prostate cancer. So it's very important to rule out right away prostate cancer in elderly men complaining of bone pains.
Especially if it's in the, like as you said, is a lot it will manifest like in bone pain, and they think it's orthopedic in the spine, but you should, it's better, I mean, thing is, rule out prostate cancer because
Correct.
it has metastasized, which is a bad thing when it metastasizes.
Correct.
Doctor, do you find that, or like in at least in your experience, that it's more common now than it was before?
That's a very good question, because as I said, no, unfortunately, during our lolo's time or even my dad's time, we didn't have the diagnostic acumen. Most of the time when they look at prostate cancer, it's all it's all metastasized, it's all over the body, and there's nothing to offer except for hormonal control. So most men during that time lose their balls. Urologists will just cut off the balls to cut off the testosterone, and that's it. But now we cannot actually prevent it, but we can actually cure it.
Yes, okay. So it is curable.
It's curable now, especially if it's early diagnosed.
Okay, so you can't actually prevent it from happening, but you can cure it. So that's that comes with the diagnostic test that you mentioned, and of course the visits to you, to your urologist. If you're a male, I think you should get your own urologist, especially when you get older, to deal with these issues, because doctor, in our culture, parang, hindi, wala lang, it's part of aging lang, ganun. But you can, it might be something that can be helped.
Correct.
Do you find, doctor, I mean, this is just a question out there, do you find that there is a stigma with men having themselves checked for that, or is there any kind of stigma or something preventing?
I think before that was very common, because a lot of men really are shying away from that rectal examination, and they really fear it. That's why I'm probably blessed, because I practice nowadays where things have changed. Diagnostics have improved, treatment has evolved, and we can really make men live longer even if they have stage 4 prostate cancer with all the treatments available in the market. And if you know what to do, your patients will live long, and they can keep coming back to you, and you can give them quality of life, which we didn't have before.
Yes, doctor, you mentioned that maybe a lot are scared because, if I have something, they're gonna cut off my balls. As you said, cut off the balls, and then it's kind of like we're shy in our culture to address these things, but we have to, and we should, because as you said, you can cure it, and you can make men live longer. At this,
I think this goes beyond men, Nicole.
Yes.
For example, for women, the breast is the most common issue for women nowadays. And I think to overemphasize mammography for women is really beyond me. And knowing that you have boobs, especially in the age group of 40s and above, screening is very important too. So similarly for men, the prostate is really the organ that is commonly affected.
Yes.
The incidence is quite becoming more, and the reason why we're having more diagnosis now is because of the accuracy that we're having, the screening techniques that we're doing, which we never had before.
Thank you, doctor, for also bringing in the women. If we're told, and as you said, we must emphasize, we have been emphasizing for women to go get checked. Okay, gotta do that. And then when it comes to your breasts. And also, actually, some males get breast cancer too, as
Yes.
well.
Yes.
Okay, so
Yes.
but the prostate, it's something that we should talk about more. To
Yes.
see that you come in, get yourself screened. This is something that can be prevented, and there's accuracy in with what you're telling me. It's more accurate now. We can diagnose it and we can treat it.
Yes.
Doctor, is it true that, okay, does it, the causes of prostate cancer, does it have anything to do with genetics or like familial? Can it be genetic or familial? How much
Yeah.
does that come into play?
That's a very good question. We really don't know what causes it.
Mhm.
Okay. But we know for a fact that it is hereditary.
Mhm.
Okay. And like what you said, it's one of the cancers that can be transmitted from father to offspring. Okay. So though it's more common among black people,
Yes.
African American blacks are more in terms of incidence. Second would be the Caucasians.
Yeah.
Third will be the Hispanics, and fourth will be the Asians.
Mhm.
Unfortunately, in Asia, I think we rank number 2 in
Mhm.
terms of incidence. So those are the things that we have to keep in mind.
Mhm.
And though the incidence of prostate cancer is common among Caucasians, the incidence of high density or high grade prostate cancer is more common here in Asia. Meaning we are not affected too much of it by numbers, but once it hits a person, it's usually the high grade form or the aggressive ones.
Maybe it's also because we don't get, I mean, it doesn't get checked enough, but now you can do it. And
Correct.
this is platform to spread word about awareness that you
Correct.
can go and have it done. Okay, doctor, we just have to take a very short break, but when we get
Sure.
back, I'm going to ask you about treatment for prostate cancer and
Okay.
the like. Thank you for giving us so much information, and I'm looking forward to getting more information from you when we get back from the break, and I'm sure the audience is as well. So guys, go and pee. And or or if you're watching this and it's not live streaming, well, just go ahead and keep watching and keep listening to Dr. Sonko, because you are a wealth of information, and you're very authoritative when you speak, because I think it comes from your experience. So again, it's great to have you back on the show, and we're just going to take a short break. We'll be right back. Stay tuned to Healthline with Makati Med.
Thank you.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗂𝗶𝘁𝗵𝗹𝗁. Available for outpatient care services, our 𝗂𝗂𝗶𝘶𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗂𝗶𝘁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the 3rd floor of 𝗂𝗂𝗶𝘁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗂𝗂𝗶𝘁𝗵𝗹. Hi, this is Dr. 𝗂𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
And I'm your host, Nicole Jacinto. And we are here with Dr. Jaime S.D. Sonko, or we can call him Dr. Sonko for, just making it a bit shorter. And he is a urology specialist. And we're discussing prostate cancer. And he has already told us about prostate enlargement, which doesn't necessarily mean you have prostate cancer. It's the enlargement of the prostate. And he did say, the two things could occur separately or at the same time. So this is a wealth of information for those who perhaps do not know much about prostate cancer, want to learn more but are afraid. So I'd like to thank you, doctor, for coming on to the show. Imagine we have subject matter experts like yourself telling us about things. Of course, you can read about it online and all that, but we're talking to doctors from Makati Med who are answering questions and giving us information that is applied. It's applied every day in their practice. And of course, they have good equipment in Makati Med and they have good doctors. So, why not go there? And everybody go to Dr. Sonko. He'll be like, oh my God. Okay. Dr. Sonko, let's talk about treatment for prostate cancer. I remember, perhaps you can go through the different types of treatment and depending on what stage, please just, feel free to tell us all about that. And I do remember last time we were talking about robotics. So if surgery comes into play, you can tell us about that. I'll remind you later. Don't worry. You know how I am. I have a lot of questions. And just like, how does that come into play when it comes to surgery? Because you use robotic surgery. I remember that. Okay. So how do you treat the person with prostate cancer?
Yeah, you mentioned already, Nicole, about staging.
Mm-hmm.
We probably will divide it into stages to make it simpler. Early stage prostate cancer, meaning stage 1 or 2, where it is organ confined, or if not, a little bit outside of the prostate, this can be dealt with surgically. Okay, and whether you do the traditional open, laparoscopic, and the most recent one, robotic. Okay, you can do that. And of course, each technique has its plus or minus. But of course, definitely the robot tops it all. It's good for the patient, for the surgeon, although a little bit more expensive. That's maybe the drawback. If it's, for example, locally extensive, you can offer trimodal, meaning surgery, radiation, plus hormone.
Okay.
But if it's really far and beyond, meaning it has metastasized to your bones and everywhere, then maybe we can offer the standard hormone treatment, plus the novel hormone treatments, plus the bone treatment. So meaning there are a lot of things we can do from stage 1 to 4. And we can keep the patient alive with good quality of life. And nobody will even notice that he has prostate cancer stage 4.
Yes. All right, doctor. So thank you for telling. That was very clear for me. For stage 1 and 2, it can be treated, and I guess if the cancer cells or the tumor are confined to the
Correct.
prostate, then you
Correct.
can do surgery. And you said there are three ways to go about it. You can either, I'm sorry, I mean you can do the traditional where you open it up, and of course
Yes.
you're just like yourself have done that. You're very very experienced in that. You can go the traditional way, and then you can also use robotics. And you said every type of approach, whether
Yes.
it's robotics or doing it the traditional way, has its uh, advantages and disadvantages, or plus and minuses, as you put it. So, I guess you would
Yes.
talk to the patient extensively, and they would decide
Yes.
what they want. Now, you said that robotic surgery for you it's the best way to go, but it might be a bit pricey, and that's the drawback.
Yes.
However, okay, is there also laser treatment, or is that for a later stage? Because we'll get to that.
The laser treatment, Nicole, is for the benign prostate enlargement,
Ah, okay.
where patients develop acute retention, meaning they could not pee anymore
Yeah.
because the prostate actually encroach on the urethra completely and urine cannot pass. So
Mm.
these patients are catheterized in the emergency room, and then
Mm.
eventually they may need to undergo a laser procedure.
Mm.
So this is a different approach, but it's still transurethral, meaning there is no incision. Everything goes to the penis while you're asleep, and takes about an hour or two, and then you stay in the hospital 2 to 3 days.
Mhm. Yeah, to make sure you don't have infections and to
Yes.
manage the pain and all that. That's why, sometimes we stay in the hospital for those things. I know a lot of people want to leave right away, but sometimes that's not the best way to go. Okay.
Yes.
Thank you, doctor, for explaining the laser, that it's treatment for benign prostate enlargement, but it's like when it really encroaches on the urethra already and the patient can't pee. And it's
Yes.
all done with the penis, inserting it into the penis and the urethra, and then it takes about an hour, and you stay in the hospital for a day or two, you said. So that's basically the treatment. Now, when it comes to um to actual prostate cancer, in stage 1 and 2, you can cure it through surgery. Can I ask you, does that affect the erectile, do men, because some men will say, I don't want to have erectile dysfunction,
Correct.
and it's a big deal for them. Does it affect the ability to get an erection?
Yeah. Let me go back again a bit.
Sure.
When you talk about benign prostate enlargement and we use the laser, we do not remove the prostate per se. We only remove the encroaching glands that are enlarged and that are obstructing along the pathway of the urethra. So that's for benign prostate enlargement. But for prostate cancer, the deal is we remove the whole thing, the whole prostate. No, so that means that will involve getting sometimes into the nerves.
Mhm.
So if the patient is really purely localized, and you even did a PET scan to make sure it's localized, then you can do nerve sparing procedures to make sure he will be functional.
Okay. Like even
Okay.
without a prostate.
Yes, even without the prostate, although he will be firing blanks
Okay. Yeah.
for
So
sure.
there is fluid, and you can get an erection, you can have sexual relations, but
Yes,
there won't be any sperm there, so to impregnate and firing blanks. Okay.
correct,
So if you've
correct.
had the procedure done, and then suddenly someone you're sleeping with says you got me pregnant, so, I don't think so. You can
Yes, yes,
Dr. Sonko, see, there's some information there. Okay. And
yes.
you do remove the prostate, you said, but you have ways of making sure that the nerves still work, the
Yeah.
signal, yes,
Nerve sparing.
nerves
But if
there.
the patient has far advanced disease or a little bit more locally advanced, I don't think we should spare the nerves because it might leave cancer cells behind.
Yes, of course,
So this
life.
is something that we have to discuss with the patient.
Yes. I mean, that's something that you discuss with the patient, and the patient, sometimes they refuse, I suppose. Have you had patients who have refused, even if, okay, you have had, because of
Yes,
they don't want to lose their sexual function. However, the thing is, you give them the best information, because if it's in a later stage, I mean, you choose your life or your sexual function.
Yeah, because if, for example, after surgery, because you spared the nerves and your lines of resection are positive, the patient may need radiation,
Yes,
localized radiation to go after the cancer cells, and it may damage the nerves as well. So you still end up impotent.
okay.
So these are the things that the patient should probably know. That when we are dealing with the prostate, it's like we're peeling an onion.
Yes.
It's like layer by layer. But in any event that the disease is far advanced, a little bit more advanced, or it may be localized, but involves practically the whole prostate, that's hard to say.
Yeah. Does it happen that you have all of these, of course you have the diagnostic tools, but by the time, has it ever happened like by the time the patient had the surgery, like, okay, it spread a little too much, we can't, we
True.
can't
Very true. Very
Okay.
true.
All right. And then you mentioned radiation. Can you describe how that happens? Like, do they have to go and get radiated, like in a specific area, like every day, for how long, how many weeks, that type of thing?
Well, yes, because the prostate is already out, the radiation fractions will be less. Okay, normally they get, instead of the 4-week, 6 or to 6-week course of radiation when the prostate is there. For patients who underwent surgery and less extensive disease, you may get from 12 to 15 or even 18 sessions, and that's it. As compared to one who never had this prostate removed, or the one that has extensive disease, then you will have the gamut of 4 to 6 weeks of radiation.
And that's every day, doctor, like usually at
Every
the
day,
same
Monday to Friday, or 20 minutes a day.
20 minutes a day. All right. So it doesn't take that long, but you just have to really go every day to make
Yes.
sure that,
Yes.
that you're getting the best treatment from the doctors. I mean, they're telling you, like you tell your
Yes.
patient that you should do this, and then,
Yes.
so, don't be absent.
Correct.
Radiation. I was always absent in class. My God, when I was a kid. So I'm suddenly remembering absences. So don't be absent for the radiation. You can ask my teachers. Absent. Okay. Yeah, that's something about me, but not when I really like the classes in college. Okay, let's not go there. There may be an ex-professor or teacher watching here. Okay, doctor, when it comes to the hormones, you mentioned hormone treatment. How is that administered? Is it pills? Is it through injection? And also, I think I'm not sure if you were alluding to like something that men can take, or it's a new thing that may prevent it or may help, like it's a new type of medicine or hormone.
Yes. Yes. The standard hormone will be the one that blocks the supply of testosterone from the brain, which stimulates the testicle to produce testosterone. We call it the negative feedback. So every time we inject this hormone, which is normally 3 to 6 months in effect, we're blocking the supply of the LHRH2 or the luteinizing hormone to the testicle. So it stops sending messages to the testicle to produce testosterone. Because the primary source of testosterone are your balls. That's why they cut it off.
Yeah, okay.
So the injection, without cutting the balls, blocks the supply of testosterone from the brain to the testicles. Okay, that's one. Now, recently, we found out, though the prostate is hormonally dependent, in advanced cases, this testosterone blockade is not enough.
Okay.
Because the cancer cells are wise to look at other routes and spread. So we are now using the novel hormone treatments, or the newer treatments available. We had them since way back 2010 up to this present time. And several generations of drugs have been coming out, and they've been good in blocking and promoting longer health. Okay, they may have their side effects too, but then, including expense, of course, but they're good.
May I ask,
Yes.
You said you inject the hormone, and then you have the novel, that's the newest one. How long does the patient have to be there in treatment, and like, is it daily too? Like you said about maybe 3 to 6 months, but do they have to go daily or just
No.
weekly?
If this is stage 4 disease, where
Okay.
surgery will not help you,
Okay.
these injections are given every 3 or 6 months, whichever the
Sorry,
patient
every
prefers.
Thank
Every
you.
3 to 6 months, but the tablets are taken every day.
Okay, tablets. So it's a
Yes.
combination of injections and tablets. And
Yes.
then where do you inject it, doctor? To
It
the
can be injected into the belly fat or into the buttocks of the muscle buttocks. So there are two routes that it can be given, intramuscular or through the subcutaneous or belly fat, as I was mentioning. Now, for those patients that are potentially contaminated after surgery, where you found out your lines of resection were positive, your seminal vesicle were positive, which houses the sperm or some lymph nodes, then you can do both radiation plus hormone on a limited scale. Okay, like radiation for a few weeks, and then the hormone maybe for 2 years.
All right. Thank you, doctor. That is so informative. And I'm very like glad that like you're known, you answer the hard questions like, okay, we may, when we open up, we may find that there's more. So I
Yes,
mean, they're just hard truths that people have to deal with. And like
yes,
it's horrible. Do you ever like recommend, do you work holistically with other doctors? Like, do you have patients who, you might recommend to see a psychiatrist or a counselor or a therapist? Because of course a diagnosis is devastating. The diagnosis of cancer, any kind of cancer, is devastating to the patient and people who care about them.
Well, I'm part of the Makati Med Cancer Center,
Mhm.
and we deal with patients holistically. We have a team approach if necessary. So we call it multidisciplinary. So from the radiation oncologist to the surgeon to the medical oncologist. And then, of course, like what you mentioned, we have our palliative care services, including psychiatric, religious, pain control, nutrition, and so on and so forth. So I think the best way to find out is for your main attending to determine what kind of patients do you have. Do they need this? Do they need that? And if so, then that's the time to bring them to the whole multidisciplinary team,
Yes.
and they get to meet all these persons and individually or all together. We come up with a conference with the
Yes.
patient and the family members. We discuss
Yes.
the stage and the disease, the treatment patterns that are needed, and other protocols that they want to pursue. So these are things that we can discuss in the
Yes.
cancer center.
Thank you, doctor. Ali, it's the whole package that you can give.
Yes,
And it's determined, of course, on a case-to-case basis.
yes,
Thank you for informing us that you have those services and
yes,
like work as a team. And that's
yes,
important. I think like you don't just
yes,
see one person, then have to find another one and be,
yes. No,
all.
we will do that for you. We will do that for you.
Doctor, when should men start having their prostate checked, and how frequently? At what
Okay,
age, like when it comes
okay.
to?
Yes, that's a very good question again. Normally, we see patients age 50 and above.
Okay.
But if the father or a close family relative is positive for prostate cancer, we bring it down to 45.
45.
We ask patients to start screening with their PSA at 45 and above if they have family history or a very strong, African American Black relationship or something. If not standardized, 50 years and above, we do it regularly.
How often, doctor, is regular? How often
It
should?
depends on the PSA value. If the PSA value at age 50 is very low, I can skip a year and see him at age 52. But
Okay.
if the PSA at 50 is already hovering around 3 and above, which normally shouldn't be, then I have to see him more closely.
Mhm. So this is just to draw a kind of analogy or similarity. This is like when people have a colonoscopy and then they say, okay, you're clear, come back in 10 years, and then do it again, or okay, get one in 5 years. So it's dependent again on a case to case basis, and it's the PSA that you do use. And of course, I'm sure you interview the patient the way I interview you and ask
Yes,
all of these questions.
yes,
Um,
yes.
yeah. Um, All right, doctor. So thank you for, giving us that information, because at least, you go and then you see how often it is. And as you said, hey, you might be able to skip a year. Can I ask you about younger patients? Like, do you ever see, especially you're talking about people who have a family history of it, and if not otherwise standardized, it's 50 and up. And of course, how frequently you do it will depend on your case, on a case to case basis, and your doctor. Do you ever have patients who are younger who suddenly manifest this? And
Yes,
okay,
yes. My youngest patient who had prostate cancer was 42.
42. Okay,
So that's it's rare, but it happened. We were able to get the prostate out, and he's still alive now.
that's
He's
great,
almost,
doc.
he's almost what, 57, 58. So he surpassed already the 10-year thing, and he's okay.
That's great, doctor. That's great to hear, and good news also for the viewers and listeners. I'm just curious, have you ever had anyone in their teens or 20s suddenly, manifest prostate
No, no. As far
cancer?
as I'm concerned, no. Although, of course, I've read from journals, but these are different kind of cancers.
Okay,
Uh,
so
the very young, these are what we call the rhabdomyosarcomas, or the sarcoma type of cancers, not the typical ones that you get. But in my practice, I haven't seen one in their teens.
thank you, doctor, for being open with us and sharing your experience. So, doctor, okay, you told us how, at what age, men should start having their prostate checked. The one thing about that that's just coming into my mind, would you know? You don't have to answer this question if it's too kind of complex for everyone, or it might elicit an opinion. But would you know if, like, of course, we have poverty in this country, and a lot of men will just not get checked. Would you know if there's services in government hospitals or in the provinces that do this, that check, or like, do you guys have to, I'm sure, because you do medical missions, like, do you suddenly
Yeah,
discover and recommend? Okay.
yeah, we have several government hospitals with the capacity or capability and manpower to
Mhm.
handle this. No, we have National Kidney and Transplant Institute. We have PGH. We have
Mhm.
Jose Reyes. We have East Avenue.
Mhm.
We have a lot, no? So I think it's a matter of education and putting men coming over to the clinics of this government institution, have themselves checked. Now,
Okay.
the Philippine Urological Association also has which just finished actually this June, the
Mhm.
annual PADRE. We call it PADRE, or DRE, which is basically a screening technique.
Mhm.
But of course, as I mentioned, the digital rectal examination is the one that's standard. And occasionally, this program of the Philippine Urological Association is centered into several hospitals nationwide, and
Mhm.
some pharmaceutical companies sponsor the PSA.
Mhm. Okay.
So these are things that are broadcast, on radio, on social media, and through hospital training centers.
Okay. Thank you, doctor. That's great. You never shy away from the questions that somebody like, okay, that's so informative. So what we need to do really is promote awareness. No.
Yes,
Okay.
yes.
Thank you, doctor. Okay. I think we are running out of time. So, doctor, could you say anything about, is there a way to prevent? You said it can't be prevented, but are there ways that men can perhaps change their lifestyles that might help them to not get prostate cancer or lessen their chances?
Yeah, I think living healthy. I
Mhm.
always say what's good for the heart is good for the prostate.
Okay. So don't break
So
your heart because your prostate might get broken. Don't let anyone break your heart that badly. If you have a broken heart, go to Dr. Sonko. Be like, you know what? Treat your heart. Just treat your emotion. We have also doctors here who can help you with a broken heart. Don't break your heart. Don't break your prostate. Okay. And then, do you have any, like, advice, or any words of wisdom, or anything you'd like to you tell men who may suspect they have prostate cancer or who already have it?
Well, you know, I always tell my patients that, you know, after having a checkup, if you're in doubt, get a second opinion, get a third opinion. You have to. But I think it's the consciousness on their part to have it evaluated, especially if you think you have one, or you have a family history, or, you know, things like that, or you feel something different. The best thing that will tell you is your body. When your body knocks at you at a certain level or a certain point, I think have it checked.
Yes. Like when my body tells me you want pork, I listen to it. Not all the time though. But you will also feel it. And if you have doubts, have it checked. I'm just to, you know, as we round off our our discussion, you said get a second, get a third opinion. So doctor, this is like you're not the type of doctor who would get angry at a patient for getting a second or third opinion.
No.
And they could come back.
I get one. In fact, I asked them to go seek another opinion if you don't trust me. I'm a urologic oncologist, so my specialty are cancers. But there are other guys that are outside who are still or are also doing that. So you can get a second or third opinion just to be sure.
And you take them back because that's something in our culture. Na, I don't want to go to another doctor.
No.
I might get hurt.
I don't take things personally. Patient wants me.
Thank you, doctor. And it's good to hear that. No, because baka magalit si ganyan. Like, I don't want that doctor to make tampo, but I have doubts. So for you, it's okay. Go get as many opinions as you want, as you need to.
It's your right as a patient. It's your right.
Thank you, doctor. Thank you. I'm so happy there are doctors like you. May you guys multiply. Okay, thank you so much, doctor. Is there anyone you'd like to say hello to before we sign off for the show today?
No, it's just that, you know, maybe I have to highlight also that our robot in Makati Med is already functional for the last, and it's doing great. So it's not to advertise it, but just to let you know, because this was our topic before.
Yes.
And, you know, and we can help a lot of people using this new equipment.
Okay,
Yes.
I'm gonna say something really quick before I sign off, doctor. In related to that, I remember how you told the history of how robotic surgery came up. It was invented by, this type of surgery that you do. The American military did it so that they could operate off-site during, you know, when men or soldier or women, even soldiers, are at war, and a robot is, you know, because they need people, a robot can do that. You sit in another room, you operate the robot yourself. There's few people around who help with the surgery, meaning less infection also. And you can get accuracy as well. And there are things the robot can do, like you can attach as many arms, well, not maybe 100 many arms as you want, so that it can get into that organ or gland or whatever it is that it needs to get into. And it's precise, you're controlling it, but it has that smaller capacity that maybe human hands cannot touch. Okay, so that's all, just to help you, also not to advertise it, but to highlight that as well. Thank you, doctor. Ako pala yung nag-last word, hindi ikaw. But I remember our conversation, so okay.
Yes.
Thank you for telling us all about it. And please come back on the show to discuss
Anytime.
more. Okay. Thank you,
Anytime.
doctor. I
Thank
hope
you.
to see you in person soon, but not for any issues. Just hang out. Okay. Thank you.
Thank you.
Thank you, folks, for tuning in. And stay tuned for our next program. That's 𝗂𝗶𝘁 Bernard Tan. And so we'll see you again next week. Healthline with Makati Med on DZRJ AM 810 AM. Radio Bandido. Bye for now.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of